Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today, we will study a very important topic, that is your community acquired pneumonia. And you know what? It can be asked either as a short note or as a long answer question. So prepare this topic in that manner. Let's start. So, community acquired pneumonia is basically an infection. Infection of what? Infection of your lung parenchyma. Okay. Infection of your lung parenchyma occurring in the individuals who has not been hospitalized in the hospital within the 14 days, because we also have something called as hospital acquired pneumonia, and that mainly occurs in the people who have a history of hospitalization, okay, who have a basically history of hospitalization. So what is the etiology and the causes? So you have the typical bacterial causes. What are they? First you have is the Streptococcus pneumonia, and it is the most common cause of community acquired pneumonia. Second you have is the Haemophilus influenza. It is mainly seen in the elderly. See, on the basis of the organism also now you will be able to appreciate and you will be able to diagnose a case. Okay, so it's very important to know the causative agent of that particular disease, right? Next you have is the Staphylococcus aureus, and it is seen in the post-influenza pneumonia. It is seen in the post-influenza pneumonia. Next, you have the 𝗲𝗵𝗵𝗺 pneumonia. It is mainly seen in patients who are alcoholic and diabetic. And you know what? You will be able to appreciate a current jelly sputum. Like it will be a red jelly like sputum. In the atypical bacteria, you have the mycoplasma. That is also called as the walking pneumonia, and it is seen in young adults with mild symptoms. Second you have is the 𝗲𝗵𝗵𝗺 pneumonia, seen in the mild community acquired pneumonia and sometimes associated with the bronchitis. Sometimes it is associated with the bronchitis. Let's see the pathogenesis. In the pathogenesis, what you need to know, you have the inhalation, like these organisms, like there is a person to whom you are talking to and by chance he sneezed or coughed, okay, so there, and you inhale that, so there is inhalation of that organisms. Then what will happen? There will be colonization of alveoli, okay, and the alveoli will show what? The alveoli will show the inflammatory response. The alveoli will show the inflammatory response. And I have told you, if there is inflammatory response, what will come into the action? The neutrophil. So there is neutrophil infiltration that will take place, and this neutrophil infiltration will give rise to our symptoms like fever, fatigue, headache, leukocytosis. These all symptoms will occur, okay. Let's see the classification. So classification is first based on the radiology. So based on the radiology, you have first one, the lobar pneumonia. In lobar pneumonia, you will be able to see that there is consolidation of the whole lobe. Like if I draw the diagram over here, these are your lungs, right? So you will be appreciate that the whole lungs will get consolidate. Okay, you will be able to appreciate that which lung is having the pneumonia, because the name is only suggesting that Lobar pneumonia. So one of the lobe is involved, either the right lobe or either the left lobe. Then you have the bronchopneumonia. Here you will be able to see the patchy consolidation, like these are your lungs, boat-shaped lungs you have. So here you will be able to see some of the patches, either here or either there. The patches. So that is why it is called as the patchy consolidation, because you will be able to see certain patches of the consolidation. Then you have intestinal pneumonia. Here what you will be able to see, there will be a diffuse pattern. Okay, and based on the severity, how will you classify the pneumonia? Okay, wait, I am giving you a flowchart. Based on the severity, you have to check if the patient is requiring OPD treatment. Then you will classify it as a case of mild. Next, if the patient requires hospitalization, then you will mark it as moderate. If the patient requires the ICU care, then it is severe. Okay. So these are basically the classification based on the severity. Let's see the clinical features that you have. First one, you will be having fever, you will be having chills and rigor. How will be the cough? The cough will be productive. Just like the cough, you all should also be productive. There is productive cough. There will be dyspnea, there will be tachypnea, there will be increased inspiration rate, there will be pleuritic chest pain, fatigue, malaise, anorexia. I have told you what is anorexia. It is a psychiatric condition. It is a psychiatric condition. Okay. The patient feels that he or she is eating too much and getting fat, but the results are opposite. They are not eating anything. Okay. What are the signs you will be able to see? You will be able to see tachypnea and tachycardia. On chest auscultation, when you will auscultate the patient, you will be able to see that there is crackles, there is bronchial breath sound, and there is echophony. There will be dullness on percussion. You have done that practical of percussion, right? In your physiology, I guess you have done the practical of percussion. What are the complications? The complications can be respiratory failure, that is ARDS, acute respiratory distress syndrome can be there. There can be pleural effusion, there can be empyema. Sepsis can be there, there can be infection, there can be septic shock, and you know what? We will learn about the shocks later on, okay? Lung abscess will be there, that is more common. What is abscess? Abscess means the formation. Abscess means pus formation. More common with S or S. Okay. Now, very important, this can separately be asked as a very short note. So, be very thorough with it. You have something called as the 𝗃65 score. In that, you have the parameters. What are the parameters you have? You have the parameter of confusion. Then you have the urea. Then you have the respiratory rate. Then you have the blood pressure. Then you have the age. These are the basically parameters that we use. Okay. So, confusion, if there is confusion present, then you will give patient the score of 1. Urea, if it is more than 7 milliosmoles per liter, you will give it as 1. Respiratory rate more than or equal to 30, 1. Blood pressure, if it is low, if the BP is low, then you have to give a score of 1, and if the age of the patient is more than or equal to 65, you have to give them 1. It's a plus point, right? So, this 𝗃65 mainly decides the treatment that is required for the patient, right? So score is 0 to 1, you have to give the OPD treatment to the patient. If it is 2, you have to consider the hospitalization. If it is 3 to 5, then you have to consider the ICU. So read the severity index also and the 𝗶𝗶𝗵 score as well. In the treatment, what you will give? You will give the empirical antibiotics like the amoxicillin and doxycycline. And if it is a IPD patient, you will give beta-lactam, macrolides and respiratory fluoroquinolone. Right, first one is if it is a outpatient department, inpatient department, and if it is severe ICU patient, severe community acquired pneumonia, if it is there, then you have to treat the patient on the ICU basis. You will give the patient IV beta-lactam like the ceftriaxone and macrolides. You will consider the coverage for MRSA like the vancomycin. Okay, so this is the treatment. Although you will learn about the treatment more in your pharmacology lectures, from there you will learn it in details. Okay, this is your summary table. Let's see, the most common community acquired pneumonia pathogen is your S. pneumonia. Lobar pneumonia have the S. pneumonia with the patchy infiltrates that are there. In the bronchopneumonia, you will be having the S. aureus causative agent. Then you have 𝗶𝗶𝗵. If it is more than or equal to 3, you have to consider ICU administration. If the sputum is red, colored sputum is there, you have to consider pneumococcal infection. And if there is a history of alcoholic, you have to consider Klebsiella, that is the current jelly sputum. So I think I made this topic very, very interesting for you. If you're having any sort of doubt, please feel free to reach me. Feel free to DM me. Thank you so much.